Hello, this is Dr. David Green, CEO of the California Pain Network. The topic today is the basics of platelet-rich plasma therapy. PRP therapy, which is short for platelet-rich plasma therapy, is a very exciting procedure. It uses your own growth factors, platelets, and stem cells to regenerate damaged tissue. Previously, it's been used for a long time in dentistry, urology, ophthalmology, and other fields, but recently it's become very popular in the musculoskeletal areas. It entails a volume of plasma that has a platelet count above what your whole blood has. Regenerative medicine breaks the mold of conventional treatments. The treatments with cortisone, which is typically what's injected into joints and soft tissue for painful musculoskeletal injuries, works well, but it doesn't regenerate anything. It doesn't fix anything. It's a proverbial band-aid, whereas regenerative treatments help to heal the actual problem while providing pain relief as well. So the indications for PRP involve, there's quite a few. Some soft tissue issues such as tennis elbow, golfer's elbow, rotator cuff tears, as well as tendonitis of the rotator cuff, Achilles, knee tendons, arthritis of the knee, shoulder, hip, ankle, etc., and then ligament injuries. If you look at the world of professional sports, athletes are using PRP like crazy. In basketball, you have athletes like Kobe Bryant, Tiger Woods in golf, Rafael Nadal in tennis. The Dodgers, I think 3 of the current team's players have used PRP recently. So it really is impressive, number one, how well it works, and number 2, how much it's catching on in professional world. How is PRP performed? Well, first blood is collected just like a blood draw. It's extracted using a syringe, and then it's put into a centrifuge, which is a machine that spins it very fast for about 15 minutes, and the platelets are separated from the rest of the blood. And then you end up with 3 layers. Top layer is platelet poor, the middle layer is what you want, that's PRP, and then the bottom layer is red blood cells. So what you start with is about 30 to 60 cc's, you end up with about 5 cc's. And that's what's injected into the area of pain. PRP therapy promotes inflammation, which is the first part of healing. Therefore, you shouldn't be taking nonsteroidal anti-inflammatories prior to treatment because that would counteract what you're actually trying to do. Professional sports leagues have not banned the use of PRP therapy, which is actually one of the reasons why it's increased so much in popularity. Initially, the World Anti-Doping Association banned it, but as of a few years ago, they said there's lack of any current evidence concerning the use of these methods for purposes of performance enhancement. So what are the outcomes? A recent study of over 20 knee patients showed no change in arthritis in over 80% at 1 year with just 1 injection. Pain scores significantly decreased, whereas functional and clinical scores increased at both 6 months and 1 year. That was just with 1 injection. Okay. Basic science studies show that PRP treatment may improve healing in many tissues. Large clinical studies in humans do not exist yet to show this. There was a study out of South Florida that looked at PRP for tennis elbow in 30 patients. These are patients who had tried everything, and all they were left with was facing the decision of surgery or no surgery, and over 90% of patients were able to avoid the need for an operation with the procedure. More studies are needed to prove the effectiveness of PRP treatment without a doubt, and to research the best ways to standardize the treatment's preparation. Okay, we have plenty of studies that looked at 20, 30 patients. It'd be better if we had some that looked at, 50, 100, 150, but everything so far is pointing in the right direction. When you look at the risk versus benefit of PRP, I mean, it's pretty impressive. It's your own blood, okay, so you're not getting somebody else's tissue. It's an outpatient procedure. Takes about 30 minutes. You might have increased pain for about 48 hours because of the inflammation that's being sparked up, but that goes away. You can have a series of 1, 2, or 3 injections, for best benefit. One of the downsides is it's not covered by insurance. You're looking at anywhere from $500 to $1,500 depending on the location. Studies are showing excellent outcomes with a slight downside. I mean, there's very little risk to this procedure. There's a minor risk of infection. That's about it. You're not going to have a rejection reaction because it's your own blood. The top pain management clinics in California are affiliated with the California Pain Network. There's multiple clinics throughout the state. Over 50 insurances are accepted with over 25 treatment options provided. Overall, the average success rates for pain relief and avoiding surgery are over 90%, and the pain doctors are board certified and award winning. Visit us online today at californiapainnetwork.com and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the California Pain Network. Your pain stops here.